Great. Yep, that goes to my. All right. Thank you for joining us, everyone. Welcome to Webinar Wednesday. My name is Rachel Watkins Peterson, and we're going to go ahead and get started. It's been a while since we've done a Webinar Wednesday, and I'm glad everyone could join us. First of all, I just want to start off by saying that we do serve all 72 counties and 11 tribes in the state. So regardless of where you're located, you got that, Les?
Yep, I'm on it.
Okay, perfect. So regardless where you live in the state, we do serve all 72 counties and 11 tribes. We also serve care recipients on the lifespan, meaning birth through end of life. And our mission, we promote, support, and expand quality statewide respite care across the lifespan. First of all, I'm sure there's a myriad of people joining us. You might be a family caregiver, you might be a professional, or you could be both. There are a lot of working family caregivers. But what I want to say to everyone is we hear loud and clear that a lot of times people don't know what respite care is. So if you're working with families, don't assume that they know what respite is, and you might have to explain it to them, just essentially that it's a short break for them to take a break from their primary duties, and it just gives them an opportunity to take care of themselves. This PowerPoint will be available for everyone. I'm going to have it on our website on the Webinar Wednesday page. But if you're a professional and you're working with family caregivers, or if you're a family caregiver, there are so many benefits to respite care. They're listed here on the screen. I won't read them to you since you can see them, because no one likes to sit on a presentation where the presenter just reads from the screen. But the one thing that's not on here that I do want to emphasize, a benefit, it's absolutely just as beneficial to the care recipient as it is the caregiver. A lot of times caregivers are burnt out and exhausted, and I know when I'm burnt out and exhausted, I'm not usually the most patient and chipper person, and that's absolutely something the care recipient can feel and can tell. So just as much as a benefit to the caregiver, it's a benefit to the care recipient. The first thing I want to cover are some of the RCAW training programs. All of our training programs are free. The first one is the respite care provider training. Then we have bringing respite to your community. That the intention of that is we know there's a shortage of respite care centers and respite care providers. So this is led by our training and development specialist, Vail Madsen. It's a 6-week course. I'll tell you a little bit more about it in a bit. We also have a kit for caregivers, a kit for respite care providers, and specialized training. The first thing I want to tell you about the respite care provider training, I want to emphasize that it's free, but you can work online and you can start and stop and go at your own pace. There are 10 courses. When someone completes this, they have the opportunity to be listed on the Wisconsin Respite Care Registry. And we'll talk more a little bit about this in a bit. And the really exciting thing is that the respite care provider training is available in Spanish. And I know some people are just joining, but just some housekeeping. If you could keep yourself on mute, and you can feel free to stop me as I'm talking and ask questions. And also my awesome colleague Leslie is here moderating the chat, so feel free to use that as well. All right, so bringing respite to your community, like I said, this is a 6-week course and it meets weekly. Sometimes it meets weekly and they discuss information, but then there's going to be homework throughout. It goes over business plans, program designs, how to market, the development, staffing, and the biggest questions is licensing. So Val, who's been in the respite field for 20+ years, designed this course, and now thanks to a federal grant, there are going to be train the trainer opportunities. So stay tuned for that. Something that we did at RCAW, we designed a kit for caregivers. A lot of times, a caregiver, it's hard for them to accept that they need that break, or it's hard for them to truly just surrender to say that they need help. That's something we see. It's a pretty big theme. But one of the things is it's hard to find somebody. And then when you do, it's kind of like, now what? So there's this how to train, retain, how to hire, train, and retain respite care providers. And then there's another course that's Respite 101 for family caregivers. There's also another training. The thing I want to say about the kit for caregivers, the how to hire, train, and retain, we understand caregivers are exhausted and they might not want to spend the minuscule amount of free time that they have going through a course. It's awesome if they can do that. But the key takeaway is the main documents in that course, they're also available for download on our website. So you can just grab and go. There's interview questions, and it really sets you up for how to hire, train, and retain someone. We also have, if you're interested, if anyone that goes through our respite care provider training that I talked about, but you don't have to go through that course in order to view the kit for respite care providers. It's how to market yourself as a respite care provider and how to become an independent respite care provider. Because the objective of those courses, or the why behind it, is we were getting lots of questions from caregivers saying, I don't know how to hire someone, what should I do? That course was created, as well as respite care providers that were saying, okay, I went through the respite care provider training, I'm on the registry, now what? And because of the lack of providers and the need for providers, that's the last thing that we want to hear, is that there's someone that is trained and willing and wants to provide those services, and they're not able to match up with the caregiver. So that's the why behind that course. We also have some specialized trainings. Anyone that goes through the respite care provider training, we do have a partnership with UWO, and they can take the dementia generalist for healthcare providers. Also, I want to let you know, if you're on the call today, and that, like I said, that's another online course, but if you're on this call today and you would like the code for the dementia generalist for friends and families, definitely send me an email and I'll give that to you later on, and we can hook you up with that. And it's not like we check to make sure that you completed it and you have to pay back. It's just something that we want people working with individuals living with memory impairments to have as much training as possible. We also can do other online and in-person trainings, caring for challenging moments. That's taught by Val, who has more experience, not more, she has a wealth of experience with children. But I do the managing behaviors that challenge us, that's geared towards people living with dementia. And like I said, the topics on the screen we can do online, and in some instances we're able to come in person. I also want to let everyone know that we do have a YouTube channel and tons of videos, things that can be beneficial to you. So just wanted to point that out while we're here. The next thing, we talked about the Wisconsin Respite Care Registry. Essentially what it is, it's a bridge to connect people who provide respite care to those who need it. It's free to list yourself on the registry if you're a provider. The prerequisite is that you do need to take the respite care provider training. We at RCAW, we're not the employer of respite care providers, so this is essentially a consumer-based site for people. They can search, find a provider, choose to call them, interview them, run their background check, make an informed decision if it's going to be a good fit for the family. And this has been successful for a lot of people. Also, when you do search, when you go to the registry page, you can you see on the left-hand side of the screen, you can find a respite care provider, and how you're able to do that to get someone in your area is you can choose the county that you live in. So it'll say counties provider is willing to work in, the age of the care recipient. So you would either choose child, adult, or older adult, and then type of respite. So you can choose in-home or agency-based. On the registry, there are some agencies. We didn't blanket put every single person or every single agency in the state that lists. We didn't put everyone on the registry. It's agencies that come to us and say they fill out the submission form, and essentially they're able to take more clients. There is registry compliance. It's an email that goes out, I believe, every 60 days, and people on the registry need to verify that their contact information is still up to date and current, and that they're still able to take on more clients. You can also go to the page, the same page, and you can click on Become a Respite Care Provider, and it lists some benefits to doing that. You can create your profile, but like I said, if you're an individual, excuse me, you must take the respite care provider training. So when you do search profile, this is what you'll see. You'll see their name, email, contact information, counties they're willing to work, ages, hours available, education, and any kind of other trainings that they've completed. And then you're able to reach out to them and set up an interview. The other opportunity that we have for family caregivers, it's called Respite Connections. And this is where a family caregiver can go and post. And I go to the next page, it kind of, I'm a little bit more of a visual person. So you can create a post and you can list the age of the care recipient, what they need for their care types, hours of respite, location and county, and payment sources. So when you do that, then that comes to us, we review it and revise it and blast it out and to people living in that county. And then they will get a notification that there's someone that is looking for help. And when you can also go and you can search the Respite Connections page, and it'll list all of their information, and you'll see they need help with dressing, companion care, some hygiene, the schedule that they need, and you can call and set up a phone interview and hopefully an in-person interview and hopefully make that connection happen. Are there any questions at this point? Les, I know you're moderating so Les has got the chat, so we're just going to keep on going. I didn't doubt you, Les. I just wanted to make sure. All right. I want to talk about, our grant programs. These have taken off, and I can show you some data in a little bit. The first one we're going to talk about is our Caregiver Respite Grant Program, then our Supplemental Respite Grant Program, our Group Respite Grant Program, and our Startup Grant Program. But before we do that, we love data at RCAW, but data is what makes our world go round. But there is a study and it shows that 4-hour caregivers, they self-reported less stress, 4 hours of respite care a week. They're able to do their jobs longer and safer in their homes. So a 4-hour break is what was stated in that survey. And something else that's really important, this is really a poignant image in my mind. It's just how important respite care is, and especially, so you can see on the left the average nursing home cost per year. Then you can see the annual cost of 10 hours a week at $23 an hour is $11,000. How important and how incredible it is when people can get that respite care. So now I want to go into the grants and show you how you can apply and show you who's eligible and a little bit more about them. So our first, the Caregiver Respite Grant, this allows family caregivers to apply and get funding for up to 5 days of respite care. They do have to use that respite care within 30 days of the approval date. When I say 5 days, sometimes people choose maybe a Monday and Wednesday on one week, a Tuesday the following week, etc. Some people use it 5 days in a row for 24 hours a day, but it has to stay in that 5-day window. One of the best parts of this grant, RCAW, we have no preference on who the family caregiver hires. They can hire a friend, right? Because sometimes another barrier is they might be nervous trusting a stranger. So they can hire a friend or someone who's familiar with the care recipient, a neighbor. You can also hire, of course, someone from an agency. We serve so many people. There are some individuals that apply and their loved one needs to, go to a nursing home for respite, anything 28 days or under, or an assisted living. So we have zero preference on who provides the respite. We just want those family caregivers to get the break, because you saw that data just a little bit, 4 hours a week, they self-report less burden and they're able to do it longer. So let's give you more than 4 hours a week. Let's give you 5 days. This you can see from the program's inception in our 2018 to 2019 grant period up until on the right column, you'll see the projection at the end of our grant year. These are that 94,000, excuse me, that is what we've committed to for approved applicants. But since the program started, it's increased 653%. So there goes to show you what a need there is for people to help pay for respite care. And I am going to get into the eligibility in just a second. But first, when I make this presentation, I share it with everybody. I put it on the website, and a lot of family caregivers and professionals use this a lot. So I wanted to put the steps how to apply. All of this information is also on the grant worksheet. So the first step would be the family caregiver would go online and fill out the eligibility criteria form. It's 4 questions. Essentially what that does is gets you a profile in the grant portal. You have to state that the care recipient lives in Wisconsin, and there's like 3 other questions. It's very, very easy. Then we have a supporting documentation form that's online and fillable that either, depending on the age of the care recipient, the ADRC or the county would submit. Then once we get both of those, we review them, and if eligible, we'll send the link to the application. Then we get it back and we'll review it and we can approve it. And if the eligibility criteria is turned in and the supporting documentation form is turned in and the application is filled out correctly, we can get answers back and approvals very, very quickly. The supplemental respite grant program, the application process is extremely similar, only the difference is the allowable expense. So this grant, same, RCAW has no preference on who provides these services, but a family caregiver can get $250 and they can hire someone to help with housekeeping, meal prep, laundry, lawn care, snow removal, transportation, and technology. Now the transportation, it does need to be to and from medical appointments or to respite activities. And when we say technology, we mean assistive technology or technology to help decrease isolation. There is a more detailed document on the Supplemental Respite Grant webpage that goes into more detail. These are the steps to apply, so you can get $250. And the one thing that I do want you can get $250 currently, it's every 90 days. It used to be every 60. All of this depends on the available funding that we have at the moment. But if you check the Supplemental Respite Grant and the Caregiver Respite Grant, that's the same for reapplication. It's every 90 days. It used to be every 60. But then you see how much our applications have increased, 653% by the time, since the inception, I should say. Right now it's every 90 days. Sometimes it's every 60. It depends on our funding at the moment. So always refer to the website. And we have applicants that absolutely reapply. And it's the first line on that webpage. So we always just direct people there. I don't want to make it hard for them to find. So it's literally right on top. All right, so when we talk about eligibility and what needs to be on the supporting documentation form, essentially anybody, our grants, the grants for family caregivers, caregiver respite grant and supplemental, anybody can be eligible. However, you have to try something else first. So if you've applied for a long-term care waiver or other supports and you're not expected to receive services within 30 days, or you've been waitlisted, you're eligible. If you've been denied long-term care waiver or other supports, you're eligible. And this is something that the individual from the ADRC, which is the Aging and Disability Resource Center, or the county would indicate on that form. Sometimes, functional screens, or there's other reasons why people have been denied. but if you're not able to get other long-term care waiver supports, if you have been approved and you've exhausted your funds, typically that's for individuals receiving NFCSP, the National Family Caregiver Support Program, or AFCSP, the Alzheimer's Family Caregiver Support Program. They exhaust those funds pretty quickly. If they've applied and they're receiving other supports, this is for individuals receiving CLTS. So that's children long-term support. And it's it's like acronym soup in this world. So I always try to, if I say the acronym, say exactly what it is. So if they've applied and they're receiving other supports, but they need the flexibility not covered, that's in there for people receiving CLTS that would like to apply for our supplemental respite grant program, because those allowable expenses are not covered by CLTS. Or if someone knows the last bullet point, if someone knows that they're over assets, or maybe because of the age of the care recipient or any reason why they're ineligible and they haven't applied because they're not eligible, that is the last eligibility criteria. So essentially, we didn't want anyone to have to go to the ADRC or go to the county and apply for a long-term care waiver support or program, knowing they're going to get denied, excuse me, and then go through that process. That just, it doesn't make sense for anyone to do that. So we do have caregivers. We can, we'll help them, give them the language. They can send an email or talk them through, just to call the ADRC or county and say, I want to apply for a grant, but I know I'm not eligible. Or the other reason we have these for applicants is sometimes people reach out to us and we'll say, well, you have to contact the ADRC, and they don't know what that is. Then we're able to connect them and bridge that gap, and there's a myriad of other services that they didn't know about. Are there any questions so far?
Rachel, it's Leslie. I just wanted to jump in. Ruth had a fantastic question about the caregiver respite grant program.
Sure.
Talking about if it's 120 hours that can be used total, which it gets a little confusing. So if nobody's watching the chat, I thought it would be important just to bring this to everybody's attention that the 5 days could be 120 hours if you use 24 hours a day. However, if you decide to use 4 hours a day on Monday, you now only have 4 more days of respite to use. You can't take that 120 hours and spread it over 2 weeks. Just so everybody's clear on that. If you have any specific questions, I'm happy to answer them in the chat, but I thought it would be something just to bring to everyone's attention.
Perfect. I appreciate that, because if it was Ruth's question, it was probably somebody else's question. So thank you.
Thanks, Rachel.
Yeah. So the data for the SRGP, the Supplemental Respite Grant Program, that started in 2021. It's 2023 right now, and those applications, and this data would be even higher, because I know since I've made this presentation, I've approved probably 10 other supplemental respite grant applications. But at the time of making the presentation, it was a 243% increase. All right, so this is ways that our grants for family caregivers can break down the barriers. This is absolutely for family caregivers listening on this call, but also for professionals. When you're educating families about these grants, a lot of times there's barriers to respite care, right? But just let them know that they can hire a friend, a family member. I do want to point out, though, that if the family member is hired, they cannot live in the same residence as the caregiver and care recipient. So let's just say a mom and dad are caring for their adult child living with intellectual and/or developmental disabilities. A mom cannot apply and hire the dad if they're all, or partner or whomever, if they're all living under the same roof. It needs to be someone not living in the residence. Yeah, you can hire anybody you would like. All right, the Group Respite Grant Program, it is exactly what the title is. We have agencies, organizations, other people who provide respite care to groups of people. They can hire providers and provide respite care on site if something is happening for family caregivers, like support groups, classes, conferences. We have, these are some but not all of our most recent applicants, Autism Society of Greater Wisconsin. They've already served 40 families with the grant funding that we gave them. It's the Children's Museum in Outagamie County, and they rented out the entire museum, and families can come, and they have highly trained individuals for working with people, of all different ages with autism. Parents can choose to stay, and then it kind of becomes an organic support group, or they can leave and they get 3 hours of respite care. The Fox Valley Memory Project does some really great events for family caregivers. It's caregiver conferences. That was their most recent application. It was a caregiver conference in a separate room on the premise. They hired 3 CNAs, and it doesn't have to be CNAs. It's people that provide respite care. A lot of times that can be a barrier for caregivers going to things and doing things for themselves, is they don't have respite care. There's also the Dulce Respite Center. That was during a recent conference. Families came, they brought their children. There were respite care providers on site to do things with the kids during the conference. Families, I think it was either Circles of Life or I think it was the Circles of Life conference. It was in the Dells. So there were respite care providers on site. They did lots of fun stuff with the kids, and then families could go to the conference. And the ADRC of Barron and Rusk, and I do have in parentheses next to these past recipients, just to show you the diversity of people we serve. We'll serve applicants that are providing care to children, older adults, Latino, rural. We spread it out all over the state, but the ADRC of Barron and Rusk, they do things like powerful tools for caregivers. They had a caregiver boot camp on a Saturday. It was like 8 hours. And the why is because not having that respite is such a barrier for such important things for caregivers to do. Okay, so the startup grant, this is newer. This is awesome. This is exactly what it's called. It's for people that want to start a respite care agency. The amount requested can be $5,000 to $25,000. I don't want to misspeak on the length of reapplication because this is managed by my awesome colleague Val, but I do know that you can apply more than once. But please check the website for the accurate information. Les, are you able to hop on the startup grant just so I can let everyone know? I want to say you can apply 2 times in a year, but I do not want to misspeak or misguide people. And if you can't find it, Les, don't worry about it.
I am looking right now.
Awesome, thank you. My biggest fear is giving wrong info, and then someone reaches out to Val and says, well, Rachel said, and it was the wrong thing. But these funds can be used for startup program costs, insurance, payroll, accounting, licensing, equipment, supplies, staff education. However, when you apply for this grant, a prerequisite is you do have to go through the Bringing Respite to Community workshop that we talked about earlier.
Rachel, listed here is this is a highly competitive grant opportunity. 1 program will be funded each quarter, 4 per year.
Okay, and there's no reapplication?
No, I believe if you don't receive the grant, then you are eligible to reapply again.
Okay, thank you. Why are we not going to the next slide? Let me stop share and go to because that is the last slide. I typically have a contact us and information in there. I'm sorry about that. So what I'm going to do is pop in the chat my information. And I do want to let everyone know about the, I can't type and talk like I used to. Les, do you want to talk about the summit?
I can absolutely talk about the summit. We have the summit coming up on, oh gosh, here I am. I don't want to misspeak either. June 13th. June 13th. There we go. And we would be happy to have all of you there. We are going to be in Milwaukee, talking about new and upcoming things, talking about how we can do better and how you can help us get there, kind of giving you some more information on how we work and what we can do to help. And it's kind of a collaborative event, so we can make sure that all of us are on the same page. and that, we're
And
helping
I'll
as much.
show everyone the flyer. Sorry, I feel like I just interrupted you. I'm having a bit of a delay. Did I talk over you? I'm sorry if I did.
You absolutely did not. I'm a fast rambler, so you keep going.
No, you're good. It's like, can you help me talk? And then I'm going to talk over you. But something that I do, Les, I don't think I've had a chance to talk with you quite yet about this. I'm going to go to our website and show everyone the agenda. Something I do want to point out, Les, can you see the website?
And I'm talking while I'm muted. Yes, I can.
Okay, so here's the agenda. It will be in, see, it would be so hard to do this without another staff member on the call. So I really appreciate your time, Leslie. But something that I do want to point out is registration ends today. That I need to send out, when I hang up, I need to send out a news e-blast. Okay, so in the past, this just is an example of how RCAW is, our outreach is increasing. People who want to know more is increasing. People who want to learn more, who want to network more, who want to teach more people about things in the respite world. Typically, we would have, I think the most we ever had was like 45 people in one day. It used to be a 2-day event. We're trying it as a 1-day event. And we said the absolute max that we would have when we were planning with the Italian Community Center in Milwaukee would be 100 people, right? Like that was our goal, that was our dream. Let's get 100 people from around the state together. We checked sign up today and we have 118. So we let the gentleman that's been helping us plan, let him know that. And he said, okay, for food purposes, we have to have the final cutoff tomorrow morning. So I had to go into the portal and cut off the cutoff date, or what should I say, make a deadline for registration date. So I will be sending an e-blast after this, just letting people know. So we would love to have you if you can come, but you have to register by the end of the day. So no pressure to that whatsoever, right? Are there any questions that I can answer? Leslie did a great job monitoring in the chat, but I'm wondering if there are any questions or anything I can answer for people. And if you are registered for the summit and you're not able to go, please shoot me an email so I can take your name off. We understand things happen, but it's for planning for food. We want to make sure, A, that we have enough, but we also don't want to have an overabundance. All right, well, it doesn't seem like there are any questions in the chat. I did put my email on there. You can go to our website, www.respitecarewi.org, or you could Google Respite Care Association of Wisconsin. I am confident you're able to find us and stay in touch with us, all right? Thank you, everyone.
Thank you, bye.